Okay, today we're going over our male rhinoplasty case. This young gentleman, on the front view, as you can tell, there is a slight deviation of the nose to the left side. We're going to address that, but overall we want to go for a more narrower profile, more of a narrower and more defined transition to the tip area with better tip definition and slight narrowing of the overall width of the tip and nostrils in that area. And then when it comes to the side view, go ahead and turn to the side. Yeah. On the side view, we want to bring, he does have a mild dorsal hump. We want to just reduce the dorsal hump. He's got a strong bridge, which is great. We're going to keep that, the strength of the bridge. Just the hump's going to go down. There's going to be a change in tip projection. We want to bring the tip forward. So he's going to have better tip projection, less height to the bridge. So the overall side profile is going to be more of an actor look. It goes straight down with a very subtle break point or connection to the tip. To keep it masculine, natural, but create those favorable changes. All right, anything else? So today we're doing a male rhinoplasty case. Young gentleman wants to do a couple of things as far as accomplishing a natural and masculine result, but some refinements. There on the front view, we want to go a little bit narrower as far as the dorsal profile and tip definition. And there's a slight deviation to the left side. We want to address that. So it's going to be more of a straight, slightly narrower nose on the front view with better tip definition. We want to bring, there is some humpiness to the bridge of the nose. So we want to bring the bridge slightly down. And as we talked about, the tip's going to move forward with to create more of a straight profile with better tip support. And that's going to decrease some of the curvature and flare of the nostril too at the same time with some of the tip techniques that we're going to perform. Higher, higher, higher. Let me see. Yeah, that's it. Perfect. Show me your teeth. Good. Relax again. Chances of needing to reduce, it's not a big chance, but we're just, because as the tip goes forward, there's less flare, but if need be, then we're gonna do about up to 2 millimeter of reduction. Turn this way for me. Turn towards me, and thank you. Alrighty. Okay. Okay, so this is a current shape of patient's domes and tip cartilages. We're going to be doing some tip contouring changes to create a more defined nasal tip, narrower and more defined nasal tip, while maintaining some of the good features of his strong tip cartilages at the same time. So we don't want to disrupt the integrity of the tip, but we want to just optimize the orientation of these cartilages. Remove the cartilaginous hump of the nose. So the bridge is lower here where it's over the cartilage. Now we're gonna go do our bony work, which is some hump reduction here and then osteotomies on both sides with piezo to narrow the bony vault of the nose. Just piezo, it's a lot more accurate, less traumatic to the tissue, and it gives us better results than old osteotomies. All the tension is on different parts. That should be usually. So just do that to take a look. And this is that extra refinement that we're seeing right now in the super tip area. Perfect. Today, but it's gonna look good. Okay. Put your head back, let me see. And he's done a great job. Perfect. They've done a great job with keeping things nicely hydrated. And you can see even the scar, this is a 1 week scar. It's not really that problem, it's just more red than anything. And in a matter of a couple more weeks, that scar is gonna be. How are we doing?
Good.
Good. Are we ready?
Sure.
All right. Beautiful. Ready? Let's go.
Wow, that is really symmetrical.
Yeah.
That is really strange seeing like do look very different, but looks really good, yeah.
Yeah, and then see the side view, despite how swollen it is.
So, you see?
Oh yeah. It looks just like the mock-up.
Just exactly like the actual. Exactly.
Yeah.
This difference is quite swollen right now.
Mm.
And once the
I can
swelling
tell
goes
that.
down, you get a sense of exactly what.
Yeah. Yeah. It looked good
It's
now.
always
It was
there.
good.
Yeah, all this area, that's so even by next week you're gonna see the improvement of that area. And the swelling, it's not that crazy for 1 week post-op. A lot of times, that's why we tell people 2 weeks before you feel socially presentable, and that whole aspect of the tip looking less swollen, and even the side was looking like swollen. And yeah, you see that you didn't really, once the tip is adjusted, I think the overall width of the nose is proper with some of that, just the movement of the tip.
Yeah, I think from what I've like the other.
Yeah, you're basically, if you wash the nose right now, it wasn't for the grease. Right now, it doesn't look like you had a big surgery.
I mean, I look like a normal person.
You look like a normal
It
person,
seems
exactly.
before, yeah.
You could right now go to a because that's really when you look presentable. Nose is not swollen; it's more natural.
Yeah.
At that point.
So is there like packing in my nose?
You just want to go area right above the tip.
You can watch me.
Right above the tip. You just want to compress that soft tissue. So I put that and then I go here. Sorry, I know it's a lady. I place it and then I feel a little bit of gentle pressure there. Make sense?
Mm-hmm.
Exactly that way. Some people do it day and night skin types. I feel stronger about it, whether it's gonna make much of a difference, because I use the suture technique underneath to hold things in place. That is more effective than the tape. And also sometimes I do injections that keep the scar on top thin. Those are more important than the tape. I do those and more important things. That's why I'm not relying much on the tape. Make sense? Mm-hmm. But it doesn't hurt. That's a good thing, because I tell people if it doesn't hurt and you're motivated to do it, it might make a difference, maybe make one person difference, then you have the option. At least you know what to do if you decide to do it. Sounds good, Riley? Mm-hmm. Awesome. So have a great week.
So I'm a patient of Dr. Sedge. I got a rhinoplasty because I was really insecure about the previous shape of my nose, and it was just something I thought about a lot. The reason I picked Dr. Sedge was because a lot of his photos online of his other patients, especially with men, looked really natural, as opposed to some of the other surgeons I saw who had like much smaller noses than looked natural and just sort of weird very surgical looking results. And so my whole process has been really smooth. After the surgery, it was only about a few weeks that I was really like having to think about recovery, but it went really smooth. There was no pain at the end, and now it's been 3 months and I think it looks really natural.
And then smile.